All right, so just a message from your optometry here. So it's Dr. Quaid here in Canada. Originally from Ireland, did my optometry in the UK, undergrad in Ireland, my PhD in here in Canada. We have a clinic that focuses solely on mainly on brain injury, also on kids with learning difficulties, many of which are brain injury patients. But based on my experience in the UK, when I worked in the hospital eye care setting, I ended up doing eye exams on jail inmates for about 2 or 3 years after I graduated, and that kind of sparked my interest in brain injury. Also, having gone through it myself, I was actually in a motor vehicle accident with my dad, and I was 10 and knocked out of commission for 2 years with double vision speech issues. My neck contracted, my SEM muscles contracted and pulled my head forward. So I ended up getting firsthand exposure to a team of rehab professionals. And was lucky enough to have a neurooptometrist on my team. And COVD, or the College of Optometrists and Vision Development, is a wonderful organization in North America that has optometrists that are trained in neurovisual rehabilitation. So they can use lenses, prisms, rehabilitation techniques to basically rehabilitate the visual system. So if people want to know what vision therapy is or optometric visual rehabilitation is, we basically teach brains how to use eyes. People don't realize that 40 to 50% of the brain's neural machinery is visual machinery. So when patients have a concussion and they don't recover, i.e., post-concussion syndrome, about 69% of those patients have either eye tracking, eye focusing, or eye teaming issues. And light sensitivity and hypersensitivity to peripheral motion is a really important component to that. So my PhD and my postdoctorate was in that area. So I basically spent 3 to 4 years studying how the brain processes visual information, and the more I study it, the deeper the rabbit hole goes. But certainly here, even in Toronto and Ontario, we've got a really good team of neuropsychologists. We've got a doctor of audiology. We've got a physiatrist. We have a really nice interdisciplinary team. And I think everybody's skills in this area is valuable, but it's more important what is done in what sequence, because there's neck issues, there's back issues, there's vestibular issues, there's visual issues. But in my experience, treating the neck and the visual system early is really, really important. Yes, you can get to vestibular issues and hearing issues, but the neck, the bigger muscle groups, and the visual system are the two key areas to address very, very early on in the process. And in our clinic, we've actually we're in the process of publishing the data with about 130 patients that we treated from start to finish. We're showing very good results in terms of visual rehab. So the bottom line is it can be treated and things can be made better, because in this post-concussion syndrome population, there's a 3 times higher rate of suicide. That's a Canadian statistic from the CMAJ. And tragically, 50% of the patients who tragically follow through and do it have a documented visit with a physician in the last week of life. So these patients need help. It's not that they're not looking for it. In my opinion, a lot of the time they're looking for it, they're not getting it. So we need to make sure they see the right people in the right sequence, and make sure that these people that they see actually know what they're doing. So covd.org is the website. You can find fellowship trained and US board certified optometrists on that area. They're neuro optometrists that can help your patients. How's that, Doug?